Hi, and welcome to Home Care This Week. Here's what's going on in and around Santa Clarita Valley this week. On Monday, March 27th, at the Henry Mayo Fitness and Health Center, there'll be a class entitled Continuing Your Journey with Diabetes. This class is designed to enhance your knowledge of diabetes. You'll learn how to prevent and treat many complications and find out the most up-to-date information and medication, and to help treat diabetes and new advancements in technology to better manage it. Contact us here at Home Care Services for more details. A really good class and subject here at the Henry Mayo Fitness and Health Center in Valencia. Also on Monday, at the YMCA, it is water exercise from 10:30 a.m. to 11:30 a.m. This class is designed for the new exerciser or member and health concerns. A shorter cardio component with emphasis on flexibility, muscle strength, and increased mobility. So this is really good for seniors and those with limited ability to get around. It's a great water exercise class there at the YMCA. Check out for more details their website at www.ymcala.org. And then there's one more on Monday the 27th, and this is at the Valencia Library from 6:30 p.m. to 8 p.m. It's in the VA meeting room. I think this one's interesting. Learn how to find your family roots and your history. This is an introduction to genealogy research. Learn how to search and participate in adding your family tree to your family tree with Family Search. It's a program that puts all that information out there, and then you can use it from others' research. Registration is required, and please bring your laptop if possible. You can contact Michael Bozick at this phone number for details. It's 661-799-6133. That's at the Valencia Library. Really interesting. Sounds like a really fun class. Go and check that out and learn about your family roots and your history. Now on Tuesday, March 28th at Oakmont of Santa Clarita from 4 p.m. to 5 p.m. It's a presentation regarding those dealing with Alzheimer's. Generally, family caregivers, anyone that is helping a loved one at home with Alzheimer's or other form of dementia. It's entitled Understanding and Responding to Dementia-Related Behaviors. When people with Alzheimer's begin losing the ability to communicate with language, behavior is one way that they have to express what they are thinking and what they're feeling. As caregivers and loved ones of those struggling with dementia, it is important to understand and identify those common behavior triggers. Learn strategies to be able to work through some of the behavior challenges common in Alzheimer's disease. Join us at Oakmont for this Alzheimer's Association presentation. Again, that's at 4 p.m. to 5:30 p.m. on Tuesday, March 28th. And Oakmont is up there on Newhall Ranch Road, Oakmont of Santa Clarita. Again, give us a call here at Home Care Services and we can get you some details. Also on Wednesday, the 29th, this is the next day, Wednesday. The first one was the dementia-related behaviors is Tuesday. And then on Wednesday, the 29th at Oakmont of Santa Clarita also. Join us for a happy hour with live music. This is the last week that Oakmont is opening their happy hour to the public, and it will feature a vaudeville music show with Bob and Bernie. They've been doing this every Wednesday in the month of March, and this will be the last one. So join us on Wednesday the 25th, and that's at 3:30 p.m. The scholarly presentation, Tataviam People Who Face the Sun. This is going to be at COC. Those of you who are interested in history, and especially local history, this might be a really fun thing to go and attend and check out. So it's at COC, and that will take place on Thursday, March 30th at 6 p.m. Anthropology professor Dr. Lori Solis will deliver the scholarly presentation, Tatavian People Who Face the Sun, based on her published book of the same title. And that's going to be at COC at the Performing Arts Center. The prehistoric Tataviam were a Native American group living in the northern San Fernando Valley, Santa Clarita Valley, and Antelope Valley. Photographs and artifacts relevant to the Tataviam will be on view in the lobby there at the Performing Arts Center prior to the start of Dr. Solis' presentation. Copies of Tataviam People Who Face the Sun, this is her book, will be on sale for $20, and that's cash only. Part of the proceeds will benefit the college's anthropology club. This event is free and open to the public. So for more information, please contact the COC Foundation, and that's at 661-362-3434. That really sounds like an interesting one to check out. At the Canyon Theater Guild, currently playing over there in the New Hall, our own live theater, it is Curious Savage. A whimsical and genuinely entertaining comedy. Ethel Savage is a somewhat unconventional but kind new widow whose husband left her a substantial fortune. Her self-seeking adult stepchildren have her committed to a private sanatorium. She gets to know the colorful social misfits there who could benefit from the help that she wants to provide. Through her simple belief in the justice of her cause, they join forces and lead the self-seeking siblings on a merry and hilarious chase, ultimately driving them to their own destruction. Sounds like a lot of fun, and then this is obviously something that's playing throughout the next, I believe, few months. So check out the schedule there at the Canyon Theater Guild website, and they're at www.canyontheatre, that's theater, theatre.org. And finally, on Friday, March 31st, at the Senior Center, it is a computer class called Ask It Basket, and it's from 11 a.m. to 12 noon. This class is designed for the student who is just using the computer and has some questions. All questions are important and valuable for everyone in this class. Join us for help and assistance with computers, and this is kind of particularly designed for seniors who have a little bit of, maybe have some struggling with computers and learning how to use them, getting on the internet and so on. But they can be really helpful, and with just answering a few questions can allow those seniors to really, use that technology to their best benefit. And again, that's on the 31st, Friday, at 11 a.m. to noon. And that's it for this week's portion of the events and the resources and so on going on in and around Santa Clarita Valley. And now it's time for our focus segment. This focus segment is designed to get a little bit in depth on certain different issues that are important to seniors and for the families of seniors or a loved one in their home. We had a chance to talk with Dr. Paula Bailey Walton, who is of the Heritage Sierra Medical Group. And we were talking to her about senior depression. This is a subject that a lot of people don't really realize is a big problem, but it is a large one and a growing one in the senior population. And Dr. Paula Bailey Walton, I had a chance to talk with her about senior depression and a little bit about the diagnosis. And while we as non-physicians aren't people who are going to be actually diagnosing the problem, it's important that we understand what is involved in that so that we can kind of help and look and understand the signs and maybe some indications that there might be an issue here with senior depression. So it's good to understand how that diagnosis works, and here's a bit of my conversation with Dr. Bailey regarding that. Let's talk a little bit about diagnosis and treatment of depression and what you go through in terms of that basis or that analysis and so on.
Well, often patients don't present saying, I'm depressed. They'll often present with what we call a positive review of symptoms, meaning everything hurts, their teeth itch, their ears, are numb. Many positives on the review of symptoms when we talk about how you're feeling from head to toe. Does that make sense?
Mm-hmm, yeah.
And so that's a clue that a patient may have depression as an underlying component of their illness. Sometimes people are there for an insignificant problem. Why would you make a doctor's appointment, take a day off of work, drive all the way here, park, pay, come up, wait in the waiting room because of a little boo-boo on your toe? Okay. And so basically the insignificant problem is often a clue that the patient really has another agenda, that they have something else that they want to talk about. So, those are some tips. Sometimes it's just the affect of the patient, that, gives you a clue that, gee, this person seems kind of low energy, a little bit withdrawn. And it will tip me to go ahead and go through the depression inventory. And then we're looking for sadness or depressed mood and loss of interest in things patients used to enjoy, which is also called anhedonia.
Okay.
And then we're looking for 2 other variables: sleep disturbance, loss of appetite, feelings of hopeless, helplessness, worthlessness, guilt, anxiety, feeling overwhelmed, unmotivated, loss of libido. Those are other factors that we take into account when we're making the diagnosis. And the symptoms need to be present nearly every day, most of the day, for 2 weeks or more.
Okay, so that's kind of at least the basis of, of a diagnosis and the things that you're looking for, and a family could even look for to help with this thing. Okay.
And then when we talk about, well, what's going on in the brain, is medication going to turn me into a zombie? Is the medication going to change my brain chemistry? Absolutely not. What's going on is that neurotransmitters called serotonin, norepinephrine, or dopamine are used for neurons to talk to each other. Okay, so you have one neuron here and one neuron here, and they want to have a conversation. They want to send information through the brain. So serotonin comes and meets the receptor. There's a conversation, and then the information is transmitted, and the serotonin is taken up again. So reuptake of this serotonin, okay, is what is considered to be the problem in depression. They think that this conversation is too short, that the reuptake of serotonin is happening too quickly or in too large a volume. And so what a reuptake inhibitor does is it allows this conversation to occur for a longer period of time. Does that make sense? Yeah,
okay. So it's and that's the normal functioning.
Right.
And so it's trying to get it to that conversation is in a little bit more normal state.
Correct. So you could think of that the serotonin in the space between these 2 neurons is being removed too rapidly in the depressed person.
Okay.
And so we inhibit that reuptake. We inhibit that clearing away of serotonin from the synapse with these medications.